move into a time for questionings, allowing for one question and one follow-up from each from everyone, and then if we have time, a round of second questions. And that is it. So whenever you're ready, Dr. Hirji.
Okay, thank you, Courtney. Let me just confirm with everybody that they can see the slides. Great, excellent. Okay, so I'll do my usual update on our cases, but I want to just take a moment to focus on what happened in Europe. I've often looked to Europe as countries that are broadly similar to us, have taken broadly similar approaches to managing the pandemic, but often have experienced things before us or acted before us. And I think that's actually true of what's happened in recent weeks, where back in February, a lot of countries in Europe basically backed off their COVID-19 precautions, eliminated mask mandates and the like before we did here. And I think we can see what was the impact of that there as a warning of what maybe we can expect here. Before that, though, I just want to highlight that in Ontario, we have generally done quite well in terms of preventing COVID-19. If we're looking at deaths per million people across the course of the pandemic, this is sort of what things look like. And you can see here in Ontario, we have had substantially fewer deaths than a lot of the European countries I'm going to talk about in a moment, and particularly less than the United States. And if you actually look at that number compared to the US, we're about 1/3 the deaths of the United States. So we have done very well, and hopefully that is something that we will strive to continue here in Ontario to make sure that we don't start to reflect, say, the United States or Florida, and that the 2,000 people who are still alive in our province will continue to stay alive thanks to the good work that we'll continue to do for the rest of this pandemic. So taking a look at what's happened in terms of infections when it comes to COVID-19 in Europe, this is a few of the countries that we have seen. So this was Italy here. You can see they reopened and lifted most of their COVID precautions, and you can see they saw a surge back up of infections, perhaps starting to see a bit of flattening out there. The UK, likewise, lifted their mask mandates and all their measures, and they can see they have gone upwards since then. France, they are likewise lifted everything in late February, and you can see an upswing in infections for them. Germany, they had an upswing in infections, and looks like they might be coming back down now. Ireland, you can see the upswing in infections when they lifted everything. Austria here, likewise, actually rebounded and ended up being higher than before. It looks like they may have peaked and are fortunately on their way back down. In Austria, you may remember about a week ago, actually reintroduced their mask mandate, which perhaps is partly what is contributing to that decline. And then Switzerland here, likewise, they saw a resurgence and looks like they might have be coming back down. And so, I think we can expect here in Ontario, we'll have an increase in infections. And I think the provinces recognize that. The province's messaging all along has been that we'll see an increase in infections, maybe a small increase in hospitalizations, but it won't be that bad, thanks to there being a lot of immunity out there from vaccine and unfortunately people who've gotten COVID previously. This is what the story has looked like in Europe when it comes to hospitalizations. So that is Italy again. You can see they are starting to trend upwards in their hospitalizations now. The UK here already saw their increase in hospitalizations, and those are still going up. And you can see they're starting to get close to the peak of what they had with the Omicron wave. France here, their hospitalizations, they've stopped their decline, haven't yet gone up yet. This is Ireland here. You can see their hospitalizations rebounded, and they're actually now back at the level they were during the Omicron peak. This is Austria. You can see likewise, they've ended up back at the level they were with the Omicron peak, which is partly why they brought back a mask mandate. And then this is Switzerland here, and likewise, they seem to have actually met the peak of their Omicron peak. And so I think this is a warning sign that just because there's a lot of immunity out there, it doesn't mean that we'll be able to reopen, accept more cases, and we're not necessarily going to see the hospitalizations go up, because several European countries do seem to have reached peaks in hospitalizations that are back to what they saw with the Omicron wave. And in some of the cases, it's not clear that they've stopped going up. And I do worry that that might be what's in store in Ontario. And it is perhaps hopeful, but not necessarily safe to bet that just because we have a lot of immunity, we can accept hospitalizations going up and it'll be okay. I'm not necessarily sure we can expect that it won't be as bad as the last wave. And then just finally to highlight that, of course, when more people are getting sick, more people are being hospitalized. Unfortunately, a small percentage of people are going to keep dying of COVID-19. And this is a trend we've seen in some of those other countries. In Italy, their downwards trend in deaths stopped and they have plateaued at this relatively high level. You can see far higher than they were last summer or the previous summer with COVID-19 deaths. This is the UK here. They flattened out, and unfortunately, they look like they're starting to go up in deaths a little bit. And again, this is remaining quite high, higher than they've been at times when they've had COVID-19 under control. France, their deaths, they've kind of flattened out likewise at a relatively high level, not coming down to levels that they've been able to do so previously. Germany's deaths, fortunately, those don't seem to be going up right now. They are going down for them. Ireland here, you can see they kind of continue to jump up and down, and maybe there's an upwards trend, though their data has always been kind of noisy, so it's hard to say for sure. But nonetheless, at the very least, it's not a low level of deaths that they've seen in perhaps past summers. In Austria, you can see their deaths had been increasing over time. And again, they brought back the mask mandate probably as a reflection of that. And then Switzerland here, you can see their deaths have also increased lately as well. And I do worry that sadly we may see more persons passing away from COVID-19 as we go on to through this perhaps next wave that we are experiencing. So now switch back to taking a look at what's happening here in the province and in Niagara. So these are the cases of COVID-19 in the province. The dotted line is once we started to restrict testing and weren't able to test everybody. I've highlighted in the past that we really seem to flatten out and never really got our cases back down. And you can see our cases are now starting to go back up, which makes sense because we've really lifted pretty much all precautions against COVID-19 at this point. In Niagara, it's perhaps not quite as striking yet. We've had a little bit of increase of late, but it's not looking quite as bad as the provincial numbers. Of course, we're not testing everybody, so this doesn't necessarily give us the full accurate reflection of how many infections are out there, and it doesn't necessarily as well representative of the entire population. But looking at some of the other measures we have, this orange line here is a percent positivity, and we used to think about being above 5% positive was a really bad, and of course we've remained well higher than that. And you can see the percent positivity is trending up provincially. Likewise, here in Niagara, we came down a little bit, but are going up, and we've remained far higher than we've been at other points in the pandemic. And then looking at wastewater, this is what the province is seeing with wastewater data. And from the science table, they're showing this clear upwards trajectory in terms of the wastewater evidence of COVID-19 spreading. If you look across the province, most regions are seeing an upwards trajectory when it comes to wastewater trends. And we're here in the Central West region, and you can see we are definitely part of that trend heading upwards as well. Taking a look at our Niagara wastewater treatment plants, I think the most striking one is the Niagara Falls wastewater treatment plant, where you can see we are quite high. Things came down, and now we're actually seeing high amounts of COVID-19 in the wastewater again. And you can see these levels are maybe 2/3, 3/4 of the way of what we were seeing during the Omicron wave. Other parts of Niagara, we're not seeing quite as high levels, but we are seeing the upwards trend. And I think it's very clear, whether you're looking at PCR cases, percent positivity, or the wastewater data, we are seeing an upwards trajectory in terms of our cases and infections. If we look at our outbreaks, and I've always talked about if there's more outbreaks happening, that means more people are getting infected in the community and bringing infection into an outbreak. You can see there's been quite a bit of increase in terms of our outbreak numbers over the last couple of weeks. We are definitely trending back upwards in terms of our outbreaks again. So switching gears and taking a look at hospitalized persons and people in the ICU in Ontario. This is the hospital trend in the province, and you can see we're coming down, haven't come all the way down. We're far higher than we were in the summer and fall, higher than we were back in, this previous summer. Probably more similar to where we were between the second and third waves. And unfortunately, just like that second wave where we maybe reopened too early and lifted measures too early, there's some evidence that now we are seeing the hospital numbers start to creep back up in the province. If we look at the ICU numbers, they're fortunately still on their way down. And this upwards trajectory, end of last week, we are getting close to about 700 persons hospitalized with COVID-19. If we look at what the science table was projecting, they were projecting that we would dip under 500 and then come back over 500. I don't know what that would be, maybe 850 or so hospitalizations. We are, middle of March already back up to about 700, and so it does look like we might be doing worse than the scenarios that they had outlined a couple weeks ago. Here in Niagara, when we look at our hospital numbers, you can see there's been quite a sharp increase over the last couple of weeks in terms of people hospitalized. And if we then focus on, look at the ICU numbers, those fortunately have not gone up. But if we look at the people being treated primarily for COVID-19, so eliminating anybody who maybe got admitted for another reason and they happen to fight COVID-19, you can likewise see there's been a big increase there, and it's actually rising more sharply than the overall COVID hospitalization numbers. And just to highlight, our hospitals remain above capacity. They have more patients than they have beds right now. So it is still remaining a very difficult scenario for them. And so looking across all of the data here, I think it's clear. Infections are going up, hospitalizations are going up. We're seeing a definite resurgence in a new wave of COVID-19. And just to quickly summarize the Niagara data that we've seen from about 2 weeks ago here, our PCR positive infections are up by about 14%. Our outbreaks are up by a whopping 160% during that time. Hospitalizations of people who have COVID-19 is up by 94%. If we look at hospitalizations for people primarily being treated for COVID-19, that is up by 182%. So really large increases, especially in the hospitalizations, but even in the number of outbreaks. And we can see that COVID-19 is having a bigger impact in our community. Ultimately, the most important reason we want to prevent this is, of course, to prevent the human suffering. People in hospitalized, of course, are going to go through great difficulty. Their families, of course, are going to go through real stress worrying about their loved ones while they're in hospital. And of course, people who have COVID-19, when they come out of hospital, they may have long COVID. They may have persistent symptoms that last for a long time. And it's really important for people's health that we try and prevent this. Of course, the worst outcome of all is if people sadly pass away from COVID-19. We take a look at the deaths we've been seeing in Ontario from COVID-19. We fortunately have been seeing the deaths still coming down. There is some evidence, though, we are starting to see that flatten out, which makes sense. If there's more infections, there's more hospitalizations. Eventually, we're going to start to see more deaths. And I've shown you in Europe, that's exactly the trend that they saw. And I think we need to start acting soon if we're going to prevent seeing a larger number of deaths. And even if we plateau out at this level, that's far higher than we're seeing in the summer and fall. That's far higher than we're seeing last summer. It's really not the situation that we want to be putting our residents through. The deaths here in Niagara, you can see, we're starting to go many days without deaths from COVID-19. Unfortunately, the frequency of those deaths has increased a little bit of late. As the science table highlighted a couple weeks ago when they released their most recent data, case number, hospitalizations, ICUs numbers have stopped declining, which is exactly, I think, the data we see. They expect that with relaxation of measures and increase in transmission, hospital and ICU numbers will increase over the next few weeks. The extent of the increase is going to depend on how people's risk of COVID-19, and that is going to depend on how many contacts they have, their vaccination status, and what we see with the BA2 variant. We can't control what the BA2 variant is. We are able to control vaccination status and close contacts, and that's really, I think, where our focus needs to be. I just want to highlight that when we see persons who are unfortunately dying from COVID-19, whichever wave we want to look at, it's always been people who are at the lowest income, the most marginalized, who unfortunately suffered the most from COVID-19 and had the most deaths. And that's probably a reflection in many cases that these people have fewer health resources. They're often working in frontline roles where they're going to have more exposure to the public and get more sick. and they're not necessarily going to have as easy access to good healthcare and good treatment. And I think it's really important, if we want to be an egalitarian society, that we make sure we control COVID-19, because it's disproportionate who feels the burden of COVID-19. It's disproportionately those who are least well off in our society who are going to feel the impact. Now, I highlighted earlier that we've done really well at preventing deaths from COVID-19 in Ontario. And Tara Moriarty at the University of Toronto has done some really interesting work to look at what has been the actual number of deaths that we have prevented, but also how many more people could potentially die from the pandemic if we don't control it going forward. And so she started off saying that there's over 150,000 people in Ontario who could have potentially passed away from COVID-19 if it had spread through our society back in 2010 and we had not done anything to stop it. Fortunately, with vaccination, we have been, basically permanently prevented 125,000 plus of those deaths. And that's a real huge win. Unfortunately, before we were able to get to vaccinating people, we did sadly lose about 12,500 members of our community. But there's still about 15,000 plus people who are still able to potentially die of COVID-19. So we could quite realistically see the number of deaths we've had in Ontario at least double if we don't control the pandemic and don't address it going forward. Of these 15,000 plus people, you can see that almost half of them we could prevent if we got them more vaccinated. Almost half of them are people who are unvaccinated or have been vaccinated with at least 1 or 2 doses, but don't have their 3 doses. And so I think that's one of the key things we need to be doing, is to try and get more people vaccinated, and that'll mean that we can prevent a whole bunch of deaths. But even with people who are fully vaccinated, unfortunately, some people are more vulnerable, and no vaccine is 100%. And some people, as a substantial number, could still potentially die of COVID-19. And so it's important that I think we continue to control the pandemic and start to make some of these sustainable long-term changes to our society that can make sure that we minimize the risk of infection long-term and don't see these deaths realized. And I think that's important because, we have done really well in the pandemic so far. If we don't prevent those deaths coming up, we will more than double our numbers of deaths, and we will be up somewhere here. If we are careful and we're able to address the pandemic, we can continue to have these really excellent performances compared to the rest of the globe and make sure we don't see that resurgence. I've often talked about Japan as a country that has made some of these sustainable long-term changes to prevent COVID-19 in the long term, and we can really see how many fewer deaths that they have had throughout this pandemic. And hopefully we can be emulating Japan rather than emulating some of the countries that have started to ignore COVID-19 going forward. Talked about vaccination as being one of those key things that we can do. And just highlighting here, people who are vaccinated with just 2 doses, far less likely to be hospitalized, far less likely to be in an ICU, and also far less likely to pass away. And that's our number one thing that we can do to prevent COVID-19 going forward. Unfortunately, we've seen a real slowdown in people getting vaccinated. We're fortunately still managing to vaccinate people every day and actually still doing 1st and 2nd doses in some cases. But, with the speed at which the wave is coming on, this is unfortunately not going to be high enough that we can really prevent a lot of deaths. And we really need to hope that we can convince more people to come to be vaccinated in the coming weeks. In particular, if we look at our vaccine uptake, orange are the 1st doses, blue are the 2nd doses, and then green are the 3rd doses. We've done pretty well at getting 3rd doses to our elderly population, but there's a big group here in sort of the younger and middle-age group who does not yet have their booster doses. And making sure they get their booster doses is really key. To make sure in the 1st instance, they're not hospitalized, they're not going to pass away. But in the 2nd instance, to make sure they are much less likely to spread COVID-19 to others. And that needs to be a big focus of ours going forward. Just highlighting here, we are at the Canada One Outlet Mall for our vaccine clinics and public health this week. And we'll also be at the Port Colborne Visitor Information Center at the end of this week as well. For anybody in those communities, this is the best time for them to go get vaccinated. Second thing I think we really need to be doing right now is really strengthening the message about the importance of wearing masks. The data has been very conclusive. Wearing masks protects you from getting COVID-19, but more importantly, it also prevents you from spreading COVID-19 to other people, particularly more vulnerable people who you might be around when you're out and about grocery shopping, or who are perhaps even in your own family. Even a cloth mask more than half cuts your odds of getting COVID-19. And of course, if you upgrade to a surgical mask or a respirator, you're going to see even greater protection. I've not, we've obviously had the province drop the requirement to wear masks. I've been disappointed we have not seen a lot of strong messaging from them, really encouraging and trying to convince people that it's important to wear masks. And I think we need to do that so we can make sure we limit the number of infections going forward. And then, if I'm looking overall, what I think we need to do, messaging is, I just highlighted that we need much stronger messaging from the province to take preventive measures. Stronger messaging around getting that third dose and voluntarily wearing masks. The province is saying that they want this to be something voluntary, which is great, but they've not followed that up with, I think, the strong encouragement and strong promotion that these remain important. And instead, I think a lot of people are mistakenly having the signal that masks are no longer needed. That probably means that masks are no longer important and we don't need to worry about it. And that's, I think, the very opposite of the case. And so I'd like to really see much stronger messaging from the province so we can get more people encouraged to get their doses and wearing masks. I think we really need to improve access to treatment, especially for persons aged 50 and up. Right now, a lot of the people being hospitalized for COVID-19 potentially could have been prevented from being hospitalized if they had been able to get treated. In the past, if someone tested positive for COVID-19, we in public health could see and identify that, oh, this is a high-risk person, and we would actually refer them on for treatment so that they could get that treatment in the first few days, which is when you need to get it for it to be useful to prevent hospitalization or more severe outcomes. With people not able to get tested, they're not going through that pathway where we're able to identify them. And again, there's not been much messaging from the province or Ontario Health about who should be going to see a healthcare provider to make sure that they do get tested and then perhaps get treatment for COVID-19. I think we need much stronger promotion that treatments are available and that people who are higher risk of getting severe illness can get treatment. And I'd strongly encourage everybody who's age 50 and up, if they do get symptoms of COVID-19, to use a rapid test, call their healthcare provider, make sure they get a PCR test, and make sure they start to get in line for potential treatment. Their healthcare provider can assess if they're eligible or not. I think it's really important they are doing that, and I'd like to see more promotion and hopefully even easier pathways for these people to get into treatment. So they're not necessarily need to call up their healthcare provider to maybe initiate that pathway. There can be other ways for them to more easily access treatment. I know in the United States, they're starting to roll it out in pharmacies. We need to be looking at ways to make that treatment much more accessible. I think we need a culture in this country about staying home if we're sick, so that if we have COVID-19, we're not going to work, we're not going to school, we're not going out and doing our errands, and unfortunately spreading COVID-19 to others. I think we need really strong public messaging, and this is something we have to, we started doing during the pandemic, and we need to keep doing as we exit this pandemic, and this isn't something that we backtrack. And to support the people who are probably most vulnerable, frontline service workers, we need to make sure they have paid sick days so they can actually stay home and they're not going to spread infection. Right now, that group often does not have paid sick days. They're more likely to come to work and unfortunately more likely then to be spreading infection to others because they need to look out for their economic livelihood. And staying home to keep others safe should not do something that someone needs to be economically harmed to do. I think the province really needs to update the proof of vaccination tool to incorporate third doses. That'll mean businesses, organizations that are still using the proof of vaccination tool will have it updated to the current recommendations on vaccination. I think doing this could also be a useful reminder to the public that the pandemic isn't over, that vaccination is important and they should be going out and being vaccinated. And by doing this, it'll hopefully be a signal to people that vaccine remains important and may give some more people the nudge to go out and get vaccinated. And of course, this would also mean that if we ever need to bring back a proof of vaccination tool as there's something required, we will be all set to do so. And I think the province should start planning for the possible reintroduction of mask mandates. Not saying they need to go there yet, but I think they should start signaling that this is something that is on the table, that's something that might need to be done, similar to what Australia did. We don't know what this wave is going to be like. If we see a lot of people getting hospitalized, a lot of people potentially dying, I think we do want to make sure we do address it, and that could mean bringing back mask mandates. as a thing that doesn't actually restrict people's freedom from going about their lives, but does make sure we start to protect everybody. And with these two, I just want to highlight that there remains lots of public support for proof of vaccination and for masking. This is Abacus Data's polling done last month, showing that 2/3 of people almost think that actually proof of vaccination remained a good thing to keep in place. ECOS's polling here, again, showing close to 2/3 of people continue to support vaccination for attending some of the higher risk public events. And then just a couple weeks ago, we had polling done by, sorry, their name is escaping me, Angus Reid. And you can actually see in here, we have 75% of Ontarians continue to support masking. And actually, 67% of Ontarians continue to support vaccine passports. So I think lots of support for those measures continuing, and I think we should keep them in our toolbox as ways to potentially deal with this coming wave. Just want to highlight, we put out, of course, strong messaging last week to encourage people to wear masks, and we've come up with a couple new posters that the public and organizations can use. If you're one of those settings that still requires masking, we have a poster for that. But if you don't require masking, or you aren't required by the province to have masking, but you are deciding that you want to have your premise a place where people continue to wear masks, we'll put out this poster here so that you can advertise that and hopefully help promote it. So we've tried to do our part to try and promote masking. We hope the province will step in doing their part as well to support that and promote it more. And with that, I'll stop and turn it over to Courtney to moderate the questions.
Okay, thank you, Dr. Hirji. And we will start with Paul, and you should be able to unmute.
Can you hear me okay?
I can hear you okay.
Thanks, Courtney. Dr. Hirji, given the data that you presented today, do you think should this be reigniting an urgency in terms of people getting shots, boosters, and for children who aren't vaccinated to get their shots as soon as possible?
Yeah, absolutely. I think we need to get the vaccine up for 2 doses for children. I think for adults who have not yet got their 3rd dose, this really should be a warning call that it's really important now to go out and get that 3rd dose. And I think it should be a reminder to everybody, if they're not continuing to wear masks, that's a really good idea right now to protect yourself, protect your family, but more importantly, to protect anybody vulnerable around you in the community. Yeah, it's annoying to wear masks, but we are seeing in Europe that more people are dying of COVID-19. It's a simple thing we can do to help make sure that other people around in our community aren't going to suffer the same fate.
And a follow-up?
Yes, and I think you've been hesitant to reintroduce any measures locally in terms of restrictions, but I guess, is that something you can't rule out totally, given that we don't know where this is going, but it could go sideways? Is that something that you might leave the door open to?
Yeah, I'm absolutely leaving the door open to that, with I think masking and maybe proof of vaccination being the kinds of things that we would potentially look for. I think the province set out that starting just 1 week ago, we are going to move to voluntarily doing masking. We're going to try and align with that, and just for this moment, really going hard to promote the masking. If it doesn't work and we start to see things, as you say, go sideways, I think that's on the table as something that we would consider. But right now, we really want to, highlight that we are seeing infections, we are seeing hospitalizations go up, and hopefully that'll be enough incentive to encourage people to start to wear their masks more and make sure they go and get those booster doses. Sorry, Courtney, you're muted.
Okay, thanks. Up next, we have Gord. You should be able to unmute now.
Okay, I think you can hear me now. I'm unmuted. Okay. I know you track the data and you track the numbers, and you say that further action isn't off the table. You're watching the data. How close are we to the point where you're going to take action? Like, how many more cases? Do you have landmarks that you would not want to get to before you would take action?
Yeah, I don't think we have any hard numbers at this point in time. We've only had a week of masking being voluntary. We're starting to highlight how things are getting much worse. And I think, right now we want to stick with the voluntary messaging and really trying to strongly promote it. I'm hoping the province is going to start to join us. It's a little frustrating that they have been basically radio silent about COVID-19 over the last couple of weeks. I think they need to be coming out with messaging to do the same. And I think if we are all speaking on that same message, hopefully we could see a real change. But, we'll keep watching what's happening with the hospital numbers, with the infection numbers. If they keep going up at the rate that they're going up, I think we'll start to think more seriously about some of those more aggressive actions we might need to take.
And a follow-up?
And I think I read that in the States, they're pretty close to implementing fourth vaccine doses for people over 50. How close do you think we are here in Ontario to that?
Yeah, I think that is really going to depend on what the National Advisory on Community Immunizations recommends, or possibly the Ontario Immunization Committee. I know they are looking at the issue. I don't know what their thinking on it is right now. It's important to remember, though, that in Canada versus the US, we did a very different vaccine rollout, in particular spacing that first and second doses apart. And what we saw with that spacing of the first and second doses, that we ended up with stronger immunity and immunity that didn't wane. And so because of that, when the US started to do third doses back in September of last year, we didn't have a need to, because our vaccine strengths remained quite high. It was only when we saw the Omicron variant show up and we found that we needed to do the third dose that we actually rolled out the third doses. So we didn't start doing third doses until closer to December, whereas the US had been doing them since September. And so even if the US goes down the road of fourth doses, I think there's a good chance that we might not go down the road of fourth doses nearly as early. We had 3 or 4 months later before we did the third doses. So we probably have a little bit more lead time before we need to do the fourth doses. But ultimately, this will be a decision based by the science, the National Advisory Committee on Immunizations, the Ontario Advisory Committee on Immunizations. They're going to look at what the data, the science shows on it, and give the recommendation of what the science supports.
Thanks.
Okay, thank you. And up next we have Penny, and you should be able to unmute.
Thank you. Dr. Hirji, you didn't say a lot about what's happening in schools, and I just wondered, you did talk about an increase in outbreaks. Do you have any idea where the outbreaks are coming from and whether they're related to kids back in school?
Yeah, the outbreaks are largely in healthcare institutions. We're talking long-term care homes, retirement homes, a few in congregate settings. Unfortunately, with schools, most people in schools are no longer eligible for testing, and we really rely on parents voluntarily letting us know if their child has had COVID-19. So we don't have a very good sense of what's going on in schools, what the spread is going on in schools. And so we're not really declaring school outbreaks because we unfortunately don't know if there's infection spreading in the schools or not. And that's likewise true of communities, businesses, workplaces, because people generally aren't being tested. And if they get a rapid test, they don't have to report it to us. We don't really know what's happening there. So our outbreaks are really based on healthcare institutions and congregate settings mostly, and that's what we're reporting right now. I do imagine that likely we are seeing a fair bit of infection spreading amongst children right now in schools. We know in the fall we are seeing children were getting infection at least about 25% of the time from exposure to school. And of course, there's fewer things in place in schools now to prevent children. We're not isolating children. They're not wearing masks necessarily. So I do worry that there is probably quite a bit of infection spreading among schools, but we just unfortunately are blind to it right now because of what the province's testing policies are.
And a follow-up?
No, that's good. Thanks very much.
Okay, thank you. And Evan has shared that he also doesn't have any questions this morning. So we'll open it up and see if there's any second questions. Okay, not seeing anything come through in the chat. I guess we'll end things there a little bit earlier than normal. Thank you all again for coming to this week's media briefing, and we'll see you again soon. Bye.